Friends, my nightmare as a neurosurgeon is breaking the news to the family that their dear one has a brain tumor. 20 years of neurosurgery now, I have to rehearse my dialogue each and every time, knowing the emotional outburst the family will have hearing my statement. A diagnosis of a brain tumor is not the end of the road. In fact, many brain tumors can be totally cured using the currently available treatment modalities. Of course, there are dangerous brain tumors. Some of them are the most dangerous tumors affecting the human body. What's a brain tumor? What are the types of brain tumor? How to treat? What is the outlook? Let's have a bird's eye view in this long video. Hello and welcome. This is Dr. Arun Naik from Doclog's channel, helping you to have dialogues with your doctor. Dialogue with the doctor is called a Doclog. In this channel, we have Doclogs on brain and heart health, lifestyle diseases, cancer, spine health, preventive health, and more to put you on the positive side of your health. All these are the new diseases of the modern world and are often neglected. Let's fight these diseases together. If you are new to the channel, please consider subscribing to Doclogs. All additional links, tips and tricks told in this video, I will leave the details in the description box below. If you want, you can check those out. Friends, it's a long video. Take a cup of hot coffee and join me in this very important topic of brain tumors. Now, what is a tumor? Friends, most cells in human body die and new cells are added every few hours. Dying and regeneration are controlled in the body by hundreds of cell processes called cell cycle processes. When a cell dies, the body has to understand that the cell has died, and there has to be a signal to that particular tissue to go ahead and regenerate that particular cell or cells again. A tumor anywhere in the body, including the brain, is an abnormal mass of tissue in which the cells grow and multiply without any control, unchecked by the mechanisms that control normal cell biology. Coming to brain tumors, more than 150 different brain tumors have been documented. There are mainly two main types of brain tumors, primary and metastatic. Primary brain tumors include tumors that originate from the tissues of the brain or the brain's immediate neighborhood. They are native to the brain biogenetically. These primary tumors are categorized as glial, that is composed of glial cells which are fundamental supporting cells in the brain, or non-glial, that is developed on or in the structures of the brain like nerves, blood vessels and glands. Now, the second type of tumor, brain tumor, is metastatic brain tumors. Here, tumors arise elsewhere in the body, such as a lung cancer or a breast cancer, and then travel to the brain through the bloodstream. Metastatic tumors are considered cancers and are very, very malignant. I also want to tell you about two terminologies we use in oncology practice for any type of cancer or tumor. That is the concept of benign and malignant tumors. A benign tumor, friends, is non-cancerous and it won't generally invade nearby tissues or spread into other areas of the body. A benign tumor is less worrisome unless it is pressing onto the nearing brain lobes, nerves or blood vessels and causes damage. But a benign tumor in a very sensitive brain area also behaves like a malignant tumor, in that I will not be able to remove that tumor completely without causing severe neurological deficit like a paralysis. So in essence, a benign tumor is benign as long as it is residing in the safe area of the brain. What is good news is benign tumors usually don't recur once removed, but if they do, it is usually in the same place. In fact, many tumors are cured if surgically removed completely, and benign tumors do not need either radiotherapy or chemotherapy. Now coming to the malignant tumor. That means the tumor is made up of truly cancer cells, and cancer cells can invade the nearby tissues and complicate the matter in the brain. Elsewhere in the body, malignant tumors often spread to distant areas in the body, resulting in distant tumors called metastatic tumors. Brain tumors, however, do not spread outside the head. That's a good news. Now, what are the types of benign brain tumors? I want to talk to you regarding only 4 of them. There are many, but we will discuss only 4. Number 1, meningiomas. Meningiomas are the most common benign brain tumors, comprising about 15% of all brain tumors, although a very small percentage are dangerous or malignant. These tumors originate from the meninges or the coverings of the brain and spinal cord. Meningiomas are cured if removed completely. Number 2, craniopharyngiomas. Craniopharyngiomas typically seen in children and rarely in adults. They are benign but are difficult tumors to remove because of their location near the eye nerves. They usually arise from a portion of the pituitary gland, the gland that controls many hormones in the body. So nearly all patients will require some hormonal replacement therapy after the surgery. Number 3, schwannomas or neuromas are another type of common benign brain tumors we see. They arise from the nerves coverings. Acoustic schwannoma or a vestibular schwannoma is the most common schwannoma that arises from the 8th cranial nerve or the hearing nerve. Although these tumors are benign, they can cause serious brain compression and complications if they grow large. Number 4, pituitary adenomas. Pituitary adenomas are the tumors growing inside the pituitary gland, which is the master endocrine gland controlling the entire endocrine glands in the body. A large majority of pituitary adenomas are benign and slow growing. They cause blindness and squinting of eyes if left untreated. Most of the pituitary tumors can be treated successfully. Now, what are the types of malignant brain tumors? Gliomas are the most common adult brain tumors. They arise from the supporting cells of the brain called the glia. These cells are subdivided into 3 types: astrocytes, ependymal cells, and oligodendroglial cells. So the tumor can arise from any of these 3 cell types. They are called astrocytomas if they are arising from astrocytes, epondymomas if they are arising from ependymal cells, and oligodendrogliomas if they are arising from oligodendrocytes. These gliomas can either be low grade or high grade tumors. When we talk about a tumor grade anywhere in the body, when we say low grade tumor, we mean, of course, they are cancerous and malignant, but they are relatively good tumors. They behave well and they do not kill the person usually. But when we say a high grade tumor, we mean that, of course, they are cancerous and they are dangerous. They come back very early and can kill a person, especially high grade brain tumors. Wait, things are not that simple with these gliomas. A small portion of low grade gliomas can turn into a high grade glioma after many years if not diagnosed. Let's learn more about some malignant brain tumors. Number 1, astrocytomas. Astrocytomas are the most common gliomas, accounting for about half of all primary brain tumors. Astrocytomas develop from star-shaped glial cells called astrocytes, which are part of the supporting tissues of the brain. They support various brain cells. They can occur anywhere in the brain. People of all ages can have astrocytomas. In children, most of these tumors are considered low-grade or good tumors, while in adults, most are high-grade or bad tumors. Oligodendrogliomas. Oligodendrogliomas arise from the oligodendrocytes. There are also some supporting cells of the brain, and they may be either high-grade or low-grade. Number 3, epondymomas. Epondymomas arise from the ependymal cells, that is, the cells lining the ventricular system or the fluid-filled cavities deep within the brain. They also may be low grade or high grade. Number 4, glioblastoma multiforme, or these days called as glioblastomas. This is the most dangerous, most invasive, most frustrating type of glial tumors. These tumors tend to grow rapidly, spread to surrounding brain areas in a finger-like fashion and have a poor prognosis or outcome. Glioblastoma is more common in people aged between 50 and 70 and are more prevalent in men than women. Outlook is bad overall for this tumor. Number 5, medulloblastomas. Medulloblastomas are childhood tumors and are high-grade tumors. Good thing is that they are often responsive to radiation and chemotherapy. Many of medulloblastoma children are doing well after many years of surgery. How common are brain tumors? In India, it is estimated that approximately 30,000 people are diagnosed with brain tumors every year. This figure doesn't include metastatic brain tumors, that is, the tumors spreading from other cancers in the body. What causes brain tumor? Friends, this is a $1 million question. We know very little in the tumor genesis in the body. I'll explain in simple words. In our body, cells die regularly and new cells regenerate. This process of cell cycle is controlled by genes. There are genes that normally regulate the rate at which a cell divides, and there are repair genes that fix defects of other genes. There are some genes that cause the cells to self-destruct if the damage is beyond repair. Brain tumors are supposed to arise when certain genes on the chromosomes of a brain cell are damaged and no longer function properly. It's also possible that some persons may be born with partial defects in one or more of these genes. Environmental factors may then lead to further damage of these genes and cause tumors. So when a cell is dividing rapidly and internal check mechanisms of the body is damaged, the cell mass can eventually grow into a tumor. But when a tumor develops initially, our body's immune system should detect the abnormal mass of cells, the tumor, and destroy it. But these tumors may produce some substances that block the immune system from identifying and destroying the abnormal tumor cells. Hence, the tumor grows. So basically, tumor is derangements of the processes that controls and evolves the cell growth. Once a tumor attains certain size, it develops its own internal biological environment that makes sure the tumor gets enough oxygen and nutrients from blood. Tumor needs more blood than the surrounding normal tissues because tumor growth is exponential. Tumors can produce substances called angiogenesis factors that enhance the growth of blood vessels inside the tumor. These new vessels increase the supply of nutrients to the tumor, and eventually the tumor becomes big in size due to increased nutrition. This much we know of brain tumor biology as of now, and what we know about these tumors is very, very minuscule in the whole brain tumor affair, and hence it's a long way before these brain tumors can be tackled with better therapeutics in the future. What are the symptoms of a brain tumor? Symptoms vary depending on the location of the brain tumor. Headache can occur that is more severe in the mornings along with vomiting. Many patients have seizures or convulsions. Any new onset seizures in adults should be investigated to rule out brain tumors. There may be weakness or paralysis in one limb or one side of the body. Some patients have loss of balance or dizziness, vision or hearing difficulty, facial numbness or tingling, confusion, and disorientation. I often see personality changes, language dysfunction, speech arrest in some patients. How to diagnose brain tumors? When I suspect a brain tumor in any patient, I do a complete neurological examination to identify the neurological issue. Then I may ask for a computed scanography called CT scan or a CAT scan or an MRI scan. The MRI scan shows precisely the location, the extent and spread of the tumor and is the best test to evaluate the brain tumors. The current day 3 Tesla MRI can give us so much information for diagnosis, treatment and follow-up of these patients. Magnetic resonance spectrography or MRS is used to examine the tumor's chemical profile and determine the nature of the tumor. Another scan called positron emission tomography or PET scan can help detect metastatic brain tumors coming from cancers elsewhere in the body. How to treat brain tumors? Brain tumors usually are treated with surgery, radiation and chemotherapy alone or in various combinations. When we tailor treatment for brain tumor patient, we have to consider the age, the neurological status, the health condition and the extent of spread of the tumor. Many low-grade gliomas do not require surgery if they are not causing significant brain compression. The seizures can be managed with appropriate medications and the patient can be put on follow-up. I get MRI scan every year to assess its growth. As I told, there are three modalities: surgery, radiation and chemotherapy. Actual treatment depends upon many factors. We discuss the issue with the patient and the family and give the best treatment for an individual patient. There are risks and side effects associated with each type of therapy. Let's now discuss all these three modalities one by one. Number one, surgery. Fundamental to the oncological practice of brain tumor, surgery is the best modality. Total or near total surgical removal of a brain tumor is beneficial for a patient. But my challenge is how to remove as much tumor as possible without causing damage to normal surrounding brain. Brain, friends, is very sensitive structure. Even touching merely with our gloved fingers sometimes causes damage. 20 years ago when I was in training, we had to explore the brain using MRI images and the surgeon's intuition. Because the brain is a sphere and 3D anatomy is very important. Cerebral cortex, which is very important to the integrity of neurological functions, may it speech, may it our motion, may it our thinking. If I injure the cortex, patient will definitely have some adverse neurological side effects like paralysis, speech, vision defects or walking difficulty. So these days many technologies have changed the way we treat brain tumors. High-end operative microscopes have brought a paradigm shift in brain tumor surgery. There is another new technology, what is called a neuronavigation technique, which is like navigating within a 3D mapped street. Here we load patients' preoperative brain scans into the navigation computer and the computer then gives us the 3D view inside the patient's brain so precisely that we can actually explore the brain like we do while driving using Google Maps. It allows us to avoid critical brain areas and to navigate using shortest safe trajectory or route. Neuronavigation is a game changer and it has made brain tumor surgery so safe these days. Friends, I was fortunate to have India's first neuronavigation system way back in the year 2000 and I started doing neuronavigation brain surgeries ever after. I do each and every brain tumor surgery using neuronavigation. Over the years, neuronavigation is acquired by numerous neurosurgical centers around the world and more younger neurosurgeons have done a lot of work on brain tumor surgery. Many young neurosurgeons do come to me from India and abroad to learn brain tumor surgeries using these high-tech gadgets, and they've gone back to their countries and started doing these surgeries themselves. It's very satisfying as a surgeon to see these youngsters doing complex brain surgeries better than what I do. In many cases, neuronavigation has allowed previously inoperable tumors to be excised with acceptable risks. Third, an equipment called QSA or an ultrasonic aspirator has made brain tumor surgery very safe and easy. Number 4, stereotactic surgery. Here we use a mathematical brain atlas employing a computer-assisted stereotactic frame to reach the deeper parts of the brain. Watch my channel to know more about all these new technologies and how these have made a huge difference in the outlook of brain tumors for our patients. Number 5, unawake brain tumor surgery. Yes, you heard it right. Here, we continuously assess patient's speech, thinking ability, and motor movements while we operate on the brain. The patient will be conscious and pain-free. He'll be talking to us, solving Sudoku or puzzles, singing, reading a book, or even playing a guitar. This way, we have real-time monitoring of patient's neurological functions. Number 6, brain mapping. Brain mapping during surgery, while this technique involves operating on a conscious patient using AVEC surgery. Here, we map the anatomy of their language functions, their motor functions during the surgery. I then decide which part of the tumor is safe to remove and from what approach. In a nutshell, brain tumor surgery is curative for benign brain tumors like meningiomas or schwannomas if a surgeon is able to remove the tumor completely. No more treatment is needed. In some cases, depending on the biopsy report, we may have to add next modalities of treatment. Second modality to treat brain tumors is radiation therapy. Radiation therapy uses high energy X-rays to kill and shrink the brain tumors. Radiation therapy is an option if the tumor cannot be treated effectively through surgery or if there is some remaining tumor after a brain tumor surgery. And radiation treatment is given for 21 days to 45 days depending upon the tumors. I have an even more advanced radiotherapy platform called a TrueBeam system, which is the most advanced brain tumor treating platform as of now in the world. Watch my channel for knowing more about our new TrueBeam system. Using TrueBeam, I can plan a technique called stereotactic radiosurgery or SRS, where the whole radiation can be given in a single setting. The whole treatment lasts for 10 minutes and the patient can walk home on the same day. This treatment causes less damage to the brain adjacent to the tumor. Last mile treatment in brain cancer is called proton beam therapy, which employs a specific type of radiation called protons, a form of radioactivity to treat brain tumors. This is a game changer in certain types of brain tumors. The advantage is that less tissue surrounding the brain incurs damage. This is specifically helpful in some pediatric brain tumors. The cost of setting up a proton beam therapy center is a staggering $150 million US. Yes, friends, you heard it right. 150 million USD. My hospital has Asia's most advanced proton beam therapy, wherein we have treated hundreds of difficult brain tumor patients coming from all over the world. Next modality is chemotherapy. Chemotherapy is treating the cancers using medications. This is often given in addition to surgery and radiation. I use chemotherapy for specific brain tumors, lymphomas, and some oligodendrogliomas. It is proven that chemotherapy improves the overall survival in patients with the most malignant primary brain tumors. Chemotherapy works by causing cell damage that is better repaired by normal tissue than the tumor tissue itself, and ultimately the tumor tissue dies. Chemotherapy in brain tumors mostly is given in the oral tablet form 5 days a month for 6 to 9 cycles depending upon the severity. With all these modalities currently available, the outlook for high-grade brain tumors is still bad. We haven't understood the tumor dynamics fully, and till that time, gliomas continue to kill millions of people. Many types of new therapies currently are being studied. Immunotherapy, targeted therapy, anti-angiogenesis therapy, gene therapy, and differentiation therapy. All these are in various stages of trials in the world, and in the coming days, we should see much more advancement in treating these difficult, frustrating, malignant brain tumors. So friends, a diagnosis of a brain tumor is not the end of the road. Many brain tumors can be cured with surgery, radiation, or chemotherapy. Some highly malignant brain tumor patients also do well depending upon the degree of malignancy and spread. With that, friends, we have come to the end of this long video. Thanks for watching this marathon video. Hope you found this video helpful. If you liked it, give me a big thumbs up. Share this video with your dear and near ones to put them also on the positive side of their health. If you are new here, please consider subscribing to DocLogs. It will be my honor and privilege to have you in this ever-growing community of DocLogs. Hit that bell icon to get instant notifications of my new videos. Friends, if you have any doubts or comments to make regarding brain tumors, gliomas, neuronavigation surgery, proton beam therapy, stereotactic radiosurgery, please drop your thoughts in the comment section below. I'll throw some light on those. Friends, I'll be back with another equally interesting doclog very soon. Till then, feel awesome, live awesome, and take good care of your health.